On the 12th of June, 2026, Princess Ba passed away after a long time of being unconscious after a cardiac arrest. You may wonder, why am I talking about this case and the relevance in terms of myocarditis? And I'll be playing a clip from Professor Bhakti where he raised an important question about whether or not the cause of her initial unwell was related to something else. And I'm going to take you through some of the science with regards to Mycoplasma pneumonia and a case report looking at a case where it did have myocarditis. But anyone who has been following me will know that I am likely to be looking at this from an unusual angle, especially in the context of the COVID pandemic. But at the beginning, we remember this life. She was the eldest daughter of the king. She was a lawyer, a diplomat, a public servant. She championed justice and human and women's rights. And she helped advance the UN Bangkok rules for women prisoners. So a very respected person in Thailand. And so her death is likely to be quite significant. And she had been unwell for a long time. This is the official statement from the Government Public Relations Department, and they highlighted that Her Royal Highness, Princess Ba, has passed away on the 12th of June, 2026 at 1948. She had become unwell and had gone into hospital the day before. So this case caught the attention of the world, and I'm going to show you why this became such a significant story. And it was related to an interview that happened in, I think, early 2023 with Professor Bhakti that really caused the attention to focus on this. So essentially, she had been out with her dogs and she was training them. She then had a collapse with a cardiac arrest. She was taken into hospital. They resuscitated her, but she was unconscious and remained unconscious since that point in December 2022. And the diagnosis that was put out was Mycoplasma pneumonia associated myocarditis, which caused the cardiac arrest. That may sound simple on the surface. And then what happened is that Professor Bhakti, he then shared his information, which I can't corroborate, but it highlights why this story got in the public's attention. Let's listen to exactly what he said at the time.
It's very simple. As you said, after the third shot, she collapsed one day, early December. She was perfectly well in the morning. This is very important. Absolutely well. And in the afternoon, evening, she collapsed and she had cardiac arrest, cardiac failure, okay? This went through all the newspapers. So when I was in Thailand, I arrived in Thailand on the 31st of December for a 2-week holiday. My Thai friends and colleagues arranged for me to meet two high-standing advisors. One was the privy councillor to the king and the royal family. The other was a close advisor to the government, to the top of the government. Okay, now, what has happened since then? Question. The princess is still unconscious. The diagnosis that is being spread is ridiculous. Everyone knows this.
Could you speak on that for me, actually? Because that's important, how that's not even possible in your opinion, as I understand it.
Oh, that's very easy. First, the Thai authorities said, that was in December, that she had massive hemorrhage, bleeding in the brain, okay? Which of course was nonsense because, hemorrhage in the brain is so easy to diagnose. You just look at the liquor and it's red. And it wasn't, okay? Now they changed the diagnosis, you see, and said that she had a so-called Mycoplasma pneumonia. Now, mycoplasms say nothing to anyone, okay? It's only if you've studied medicine and infectious diseases that you know that mycoplasms are bacteria that enter through the nose, go to the lung, can cause pneumonia, which can be serious, and once in a lifetime, the bacteria will reach the heart. Okay? But they said she had a mycoplasma myocarditis, which caused the heart failure. Okay? Now, anyone who's gone through medicine, anyone who would come to me and see this in the exam would be thrown out of the door. You know, it's impossible. There is not a single known case of mycoplasma myocarditis that develops within hours and causes cardiac arrest. It can't happen.
Wow.
And
while we have numerous studies, peer-reviewed and otherwise, that show that we definitely have myocarditis being caused by the injection. So choosing something that's never happened before in...
I'm going to pause it here, but you can see the context. And so when that interview happened, the big question was whether or not this was COVID vaccine-induced myocarditis as the primary cause for cardiac arrest. He said some facts there that I can't corroborate. One was that he said she had a booster injection 23 days prior to this event. If that is the case, then I am unsure how anyone could seriously discount the possibility. But as I said, we don't have that information. So what I'm going to take you through is I'm going to give you a broader picture as to what happens with regards to, say, myocarditis in terms of mycoplasma and what I look for in these cases. So the first thing is just the overview of Mycoplasma pneumonia. And it is a bacterial infection, usually quite mild, as we've described it as walking pneumonia. So meaning that people will have it and still be up and about. They oftentimes have dry cough, fever, tiredness, and sore throat. And usually it affects the lungs. And many people are still quite active with it. So it's not difficult to treat. Rarely, it can affect other parts of the body, including the heart, the brain, the skin, and the blood. And when it affects the heart, that's where you can get myocarditis, inflammation of the heart. And as we said, most people will recover well from it, but there is a cohort that can go on to becoming quite unwell. Now, one important proviso in that is that usually the people who get complications are pretty unwell with it. So they're very often hospitalized and they then get complications. It's not so common for someone to have relatively mild mycoplasma pneumonia where they are still walking out and about and then have serious complications. Not that in medicine, anything is possible. And so you never discount it, but it would not be that common. So now I'm going to take you through a real case. This is a case report. And I'm going to show you now where I think the gap in understanding lies. So in this case here, this is Mycoplasma myocarditis presenting with sustained supraventricular tachycardia, that's what we call SVT, and acute heart failure without signs of a myocardiocitolysis and extracardiac disease. So this was unusual enough that they went ahead and did it as a case report because they have clearly pointed out here that it is rare but serious. Now, what I want you to look at very carefully in terms of this, well, you can't see it here, but this was published in 2024. This is very important when I talk about this, because what it means to me is that it has happened within the pandemic period. And so that is critical for me to understand what is going on. So let's look at the history here to understand how this can present. Here you have a healthy 29-year-old gentleman who came to their emergency department with palpitations and abdominal fullness. He had symptoms for 4 days before he came to the emergency department. So that's important. He was then becoming more short of breath. He didn't have any chest pain. Other than the abdominal fullness, he didn't have any gastrointestinal symptoms. His past medical history, other than palpitations during his teenage years, were nothing out of the ordinary. Blood pressure was borderline slightly up. His heart rate was going very quickly, and his respiratory rate, breathing rate was increased at 23. Critically, his saturations were 89% on room air, which is probably what caused him to come into hospital. And they found that he had an abnormal rhythm on his ECG. They noticed that the heart's apical impulse was also displaced 3 centimeters to the left. What this meant is that he had a big heart and he had crackles in the lung bases. They did a number of investigations. His inflammatory markers were a little bit up, and they went on to see that he had a big heart and pulmonary edema. Now, this is very important again with regards to the background of this patient. And what I want to show you for those people who are clinical, they will understand here that if we're looking at a chest x-ray here, you will see that the heart is quite big. Now, what's very important about this is that this doesn't usually happen very quickly. Remember, he had a 4-day history of symptoms. And this is what he came in with: a big heart and heart failure. It was subsequent to that that he was then confirmed to have a Mycoplasma pneumonia. And when they did a scan of his chest, they confirmed here there's a patch of inflammation on the CT scan, and he had positive blood indicators for Mycoplasma. And so therefore, with the combination of his ECG changes, this was considered to be Mycoplasma myocarditis. On the surface, that sounds okay. However, there's still a few things here that I find a little bit difficult to put together. And so another thing that stood out in this case, I'm just trying to find it in the description so you can read exactly what I am reading, is his findings with regards to the echocardiogram. So when we look at his echocardiogram, this is here, it showed a moderately dilated left ventricle, that's the left side of the heart, normal left ventricular wall thickness, so the heart was not too thick. He had some regurgitation in the valves, and his ejection fraction was 30%. And critically, he had regional wall motion abnormalities at the lower part of the heart. Now, normally, when we're seeing this kind of picture, especially with regional wall motion abnormalities, it can indicate that there is some damage to the heart that had occurred before. So maybe that person had a heart attack and that area of the heart is not contracting so well. And so this would present on an echocardiogram as regional wall motion abnormalities. In effect, it's not contracting so well. That's a problem because it suggests that maybe his heart condition was not acute. Now, this is very important here because this case report was in 2024. What I'm saying is this. I checked through that case report, and it's in the description if you want to read it to yourself. And I searched for vaccination status. it wasn't there. What that means is that there was no consideration that this could have been a part of the picture. Now, in medicine, we usually use a differential diagnosis. So if somebody is short of breath, it doesn't mean that they have a chest infection. A differential would include maybe other things like heart failure, or maybe they have some underlying lung disease, or they have a clot on the lung. That's a differential diagnosis. And the differential diagnosis indicates what is on the table as potential explanations. So it doesn't mean that this case was not Mycoplasma myocarditis. I am just indicating that they didn't include the differential that would have had potentially COVID vaccine-induced myocarditis that occurred previously, for which the person then has a mycoplasma pneumonia, pushes them over the edge, and they present with heart failure. That directly would make far more sense. Let us bring this back now to Princess Princess Ba. So follow along here. Now, again, I don't have all the details, but here are the facts that we actually know. On the 14th of December, she collapsed while training with her dogs. That does not sound like somebody who was pretty unwell. She was then taken to intensive care. They then found a severe arrhythmia, so they resuscitated her. They then found evidence of a mycoplasma infection. So their presumption was that the mycoplasma infection with the markers was the cause of the inflammation in her heart. Sadly, she remained unconscious for the whole duration of the time, and she recently died at the age of 47 on the 12th of June after a long and complicated illness. Now, this is the bit that I'm saying is from a scientific point of view, it's not good enough. Here is a piece of information that very few people are aware of, and as a result, they don't even know that this is relevant. So I'm just going to tell you something that is absolutely critical, and it is linked to a paper that was published in early 2025. I covered this story. This was done by the Japanese. And the Japanese did this case looking at multiple cardiac microscars, an autopsy study with 3 people who had unexplained cardiac arrest. So they then went to do autopsy studies, and they found multiple microscars in the heart of the 3 patients who died with unexplained arrhythmias. Now, this was part of a pathological conference. And what they said, and this is really, really important. I'm going to highlight this because it is so important. Look at what they said in the paper. At our clinical pathological conferences, spanning about 30 years, multiple microscars in the myocardium, other than in cases of myocardial infarction, have never been observed. Now, what they were saying here, because the reason why this paper has been suppressed is because they dared to make the correlation with boosters. All of the patients who had this response were boosted. And what they found when they looked at the histology of the heart, they were finding these little tiny areas of scarring all through the heart. This is what they found that was unusual. No, you can get a heart attack and have a big scar. but you don't normally get tiny, multiple little scars all through the myocardium of the heart. This is what they found that was most unusual. Now, just to give you context with this, and this is how I know that this kind of research is an issue, is that I then did, and you'll see it here, I then did a check to see how many people cited this paper. Now, you remember, this has never been seen before. You would think the scientific community would be, oh my goodness, this is important. No. When I look at what has happened with this paper, there are only 6 citations, of which 2 of them are Dr. McCullough using it because he knew this was relevant. 1 other here, and that's it. Somebody included it in their book. This study should be in the hundreds of citations. It should be being one of the most important pieces of research that is being done. And let me tell you, I would have hoped that if we had sensible science, that some of the questions about the cause of myocarditis in the case of Princess Ba would be clarified through autopsy. Just do a punch biopsy. It doesn't have to be a full-blown autopsy. You are helping science here. Look and see if the pattern that the Japanese pathologist found was in the same way followed in her death. I can't express to anybody how strange it is that this kind of research is not being done. I mean, there is no explanation. I will not accept anybody saying that not understanding if what we are seeing in terms of cardiac-related disease is not linked to the potential of this very unusual finding for the Japanese. And this case here, where they were happy to label it as Mycoplasma myocarditis in Princess Ba's case as well, without looking and considering the possibility, in my view, is unacceptable. This is where we are. And the sad part is that I don't expect that this is going to get any better anytime soon. The kind of research we need to find answers for you and for your family, for the friends, for colleagues who have died, without the autopsy research, we are just blowing in the wind. Nothing will make a difference because the critical research that needs to be done has not been done. I can only hope that we get some clarification from the Thai royal family. Why would they not want to know? Should they want to know? I mean, her case may be complicated because she may have had other things happen in the 3 years, so it wouldn't be so straightforward. But certainly for anybody who has a sudden cardiac arrest anywhere in the world, their family should be insisting on the histology. If science is not interested, hopefully at least the family will be, because that answer could help to explain some of the patterns that we are seeing. So in this case, just to summarize, for the Mycoplasma pneumonia, it can occur. But what we had was a 29-year-old with a 4-day history of shortness of breath who was found to have full-blown heart failure with BNP, brain natriuretic peptide, of over 9,000. That was supposed to have happened within a week of him having a Mycoplasma pneumonia for which he had no cough. It is possible, but extremely unlikely. And if we are doing medicine at the moment like that, that is not considering all of the possibilities, then we are up the creek, because we're not going to understand anything at all that has happened in the past 5 years. I'll just quickly look here and see if there are any relevant comments. Thank you for the analysis. I learned a lot. Thank you very much. It was interesting. This is a good point. Professor Arnie Burkhardt and Professor Bhakti found the histopathological changes related to spike protein. So it's no surprise that he was suspecting that this would be part of the issue that was going on. And so these are issues that we are seeing now. There are many things that we have to overcome in the next few years. And I think at the rate we're going, this is going to take us a decade or two before we get the answers. The pressure is with the public. If the public don't ask the questions, there is no pressure on the scientific community to answer them. So I am absolutely putting the responsibility to the public. If you don't ask, nobody will try to answer. But we need a lot more work to be done. Thank you very much for being with me, and have a great evening.